As part of the special tests in an extended cardiac examination, I can now assess the patient's JVP. To begin, I'll be placing the patient in a 30 to 45 degree incline on the bed. To assess the JVP, it's helpful to landmark. First, we want to identify the sternal notch, the sternal angle, as well as the two heads of the sternocleidomastoid. To help visualize that, I can ask the patient to turn their head to the left at 45 degrees, and then have him press against my hand with his cheek, raising the two heads of the sternocleidomastoid. Inside, we can identify where the JVP is, roughly here. Once we've identified the internal jugular vein, we can place a ruler perpendicular to the ground just above the patient's sternal angle. Then we can use a flat measurement to roughly establish the height of the internal jugular vein. To assess the hepatojugular reflex, we can push on the patient's right upper quadrant and watch as increased venous return will elevate the JVP. Kussmaul's sign is increase in JVP with inspiration. Beck's triad includes hypotension, distended neck veins, and muffled heart sounds. This is your systolic blood pressure as usual. Next, listen for when the first cough sound no longer disappears with inspiration. This should be between the systolic blood pressure and the diastolic blood pressure. You can calculate the difference between this number and the systolic blood pressure. A value greater than 10 indicates a positive test for pulsus paradoxus. Now I'll be assessing for the carotid upstroke maneuver. This test is used to assess for aortic stenosis or regurgitation. It should be done when a systolic murmur is identified on auscultation. While auscultating the heart, place the pads of your fingers over the carotid artery on the patient's neck. As you listen for the murmur, there should be no delay between murmur onset and pulsation in the carotid. If carotid pulse is delayed and relatively diminished, this is pulsus parvis et tardus. It's a sign of aortic stenosis. If the carotid pulse is brisk, this may be a sign of aortic regurgitation. If the carotid pulse is biphasic, meaning there are two pulses per cardiac cycle, this is called pulsus bispherians and may be a sign of coexisting aortic stenosis and regurgitation. In this patient, I note a physiological carotid upstroke.